Should I take my child out of school? If your child is having symptoms, seek medical care, and follow the instructions from the health care provider. Otherwise, as with other respiratory infections like the flu, keep your child well rested at home while symptomatic, and avoid going to public places, to prevent spread to others. If your child isn't displaying any symptoms such as a fever or cough, and unless a public health advisory or other relevant warning or official advice has been issued affecting your child's school, it's best to keep your child in class. Instead of keeping children out of school, teach them good hand and respiratory hygiene practices for school and elsewhere, like frequent hand washing, see below, covering cough or sneeze with a flexed elbow or tissue, then throwing away the tissue into a closed bin, not touching their eyes, mouths or noses if they haven't properly washed their hands. What precautions should I take for my family if we travel? Anyone planning a trip overseas should always check the travel advisory for their destination country for any restrictions on entry, quarantine requirements on entry, or other relevant travel advice. In addition to taking standard travel precautions, and in order to avoid being quarantined or denied re-entry into your home country, you are also advised to check the latest COVID-19 update on the International Air Transport Association website, which includes a list of countries and restriction measures. While traveling, all parents should follow standard hygiene measures for themselves and their children, wash hands frequently or use an alcohol-based sanitizer with at least 60% alcohol, practice good respiratory hygiene, cover your mouth and nose with your bent elbow or tissue when you cough or sneeze and immediately dispose of the used tissue, and avoid close contact with anyone who is coughing or sneezing. In addition, it is recommended that parents always carry a hand sanitizer, pack of disposable tissues, and disinfecting wipes. Additional recommendations include, clean your seat, armrest, touchscreen, etc. with a disinfecting wipe once inside an aircraft or other vehicle. Also use a disinfecting wipe to clean key surfaces, doorknobs, remote controls, etc. at the hotel or other accommodation where you and your children are staying. Can pregnant women pass coronavirus to unborn children? At this time, there is not enough evidence to determine whether the virus is transmitted from a mother to her baby during pregnancy, or the potential impact this may have on the baby. This is currently being investigated. Pregnant women should continue to follow appropriate precautions to protect themselves from exposure to the virus, and seek medical care early, if experiencing symptoms, such as fever, cough or difficulty breathing. Is it safe for a mother to breastfeed if she is infected with coronavirus? All mothers in affected and at-risk areas who have symptoms of fever, cough or difficulty breathing, should seek medical care early, and follow instructions from a health care provider. Considering the benefits of breastfeeding and the insignificant role of breast milk in the transmission of other respiratory viruses, the mother can continue breastfeeding, while applying all the necessary precautions. For symptomatic mothers well enough to breastfeed, this includes wearing a mask when near a child, including during feeding, washing hands before and after contact with the child, including feeding, and cleaning, disinfecting contaminated surfaces, as should be done in all cases where anyone with confirmed or suspected COVID-19 interacts with others, including children. If a mother is too ill, she should be encouraged to express milk and give it to the child via a clean cup and/or spoon, all while following the same infection prevention methods. Please like and subscribe my channel for more video. Press bell icon for new video.